Hello, dear friends. Welcome back to another session of Doctor's Diary. I'm Dr. Ritu Sethi, Senior Consultant, Obstetrician and Gynecologist at Cloud9 Sector 14, Gurgaon. So, friends, today I'm here with another session, a very important session which many of my viewers have requested me to take this session again and again. So, I thought it appropriate to start with this, and I'll be taking it in two parts. So, first of all, today I would just be taking the very basics of this topic, and next time, as how the responses, I will be going on and elaborating about other points related to this topic. So, first of all, how what is the aftercare which is needed to be given to the mother after a delivery? Now, as I'm sure all of you are very much aware about that delivery can either be a normal delivery, which is a vaginal delivery, or a cesarean section. For me, the definition of a normal delivery, which in a layperson's term is a vaginal delivery, is a delivery in which the baby and the mother both are healthy and are recovering well. So first of all, what are the aftercare? What is the aftercare, which is important for any patient who has undergone a vaginal delivery? So any patient who has undergone a vaginal delivery, first of all, I find that patients are very much exhausted after the delivery, whether they have had an epidural, which is a painless delivery or not, and most of them, are kind of just quite I would say really, worn out after the procedure. And after the delivery process over, they have a lot of questions in their mind as to what is the immediate aftercare which is to be taken, and even after discharge from the hospital, what is the care which is to be provided both to the mother and to the baby. I would be focusing most on the mother's care, and in between, I would just be telling you how the newborn care is also to be done. So after a vaginal delivery, I would usually be discharging my patients after 24 hours, provided that they have no other symptoms and no other high risk factors like high blood pressure, or they are having any symptoms of fits, or they have had excessive bleeding for which uh, because of some problem happening before the pregnancy, or unless they are severely anemic, for which a prolonged stay is actually warranted, I would be discharging most patients who had a vaginal delivery after 24 hours. So, what all care is to be given in the hospital? In the hospital, first of all, after a vaginal delivery, I'm sure all of you know that there is a surgically induced cut which is given in the vagina. This is called an episiotomy. This episiotomy is sutured by taking stitches in layers, and these stitches don't need to be cut. They don't need to be removed. They don't need to be cut. Only good care of the stitches is what is required. And see, because the vagina is present in the area, which is where the vagina itself is an area which is having a lot of microorganisms in it, and also close to the anal area where uh, where passage of stools or motions happens, and vagina is the area from which the baby has come out. So the stitches which are given in the vagina are actually bound to get infected, because this area itself is something which is teeming with a lot of bacteria, fine, which can kind of grow and cause lot of problems in the stitch which has been given. So how is this area to be cared for? These stitches, like I said, are totally dissolvable and don't need to be cut. The stitches have to be taken care of very well, because if there is some kind of an infection occurring in the stitches, then usually the healing process, which is usually 2 weeks, in the kind of stitches I am giving at Cloud9 Hospital, usually they fall off after 2 weeks. And this is how I counsel my patients, that in case you are taking good care of your stitches, after 3 or 4 days, the pain in the stitches usually subsides. So, how are you going to take care of good care of your stitches? First of all, it's very important to keep them totally clean. Totally clean means that whenever you are going and passing urine, or whenever you are going and passing stool, please clean the area properly. Simple Dettol and warm water would do. Keep the area totally dry. Please dry your area once you are passing stool from front to back. If you are wiping your area, vaginal area, please wipe it from the vagina to the anus and not the other way around. Because, like I said, the anus is the area from which somebody from which you would be passing stools, motions, and this is an area which is heavily infected. So, in case you are going to clean the area from back to front, you are bound to introduce infection in your stitches. And because you're going to introduce infection in your stitches, the healing of the episiotomy is going to take longer. The stitches may even get infected in case you are not taking good care of them, and there might be pain for a longer duration of time. So keep the area totally dry. Wash it with simple Dettol and water, soap and water. Keep it dry, and please apply the ointment which we have given to you. Also, it is important to take a seeds bath daily. In the seeds bath, you are going to sit on a shallow tub of warm water for at least 10 to 15 minutes. That itself is very soothing for the stitches. And usually, I advise my patients to add some betadine to it because it serves as an antibiotic. And believe me, everybody comes back and tells me that the seeds bath is actually something which is very comforting to them, and the pain relief is there for a longer time. In case they are doing the seeds bath twice a day, thrice a day, or maybe even more. In case you feel that there is a lot of pain in the stitch line. Secondly, this seeds bath has to be continued till the stitches don't fall off. In the hospital, the nurse would be taking good care of your stitches, but it's important to take good care of them, to learn from her how the stitch line care is to be given. Of course, I will be explaining you about it, and go home and do the same once you are discharged from the hospital. The next thing, which patients usually ask me is that, doctor, bleeding will happen for how long? See, now usually after a delivery, whether it's a normal delivery or whether it's a cesarean section, usually bleeding remains for up till 4 to 6 weeks. This bleeding initially is something which is a heavy, something like a period, then gradually it becomes scantier, may stop on its own, then restart again. But this bleeding usually persists for up till 6 weeks. Now, this bleeding which is present is not something like the period bleeding. And usually patients tell me that the blood flow which is coming out is somewhat yellowish in color, somewhat, reddish, pinkish, mixed with a discharge. So I reassure them and tell them there is no need to worry unless, mind you, unless the discharge or the lochia is foul smelling, and you are not really comfortable, you feel that there is a fish like odor which is coming, so please inform your doctor immediately. In case you feel that any kind of this kind of discharge is coming from your vagina, uh, that means that the uterus lining is getting infected. Usually this discharge is because the lining of the uterus has started to shed off. Because the lining of the uterus has started to shed off, this lochia turns scantier and scantier, but may persist, like I am saying repeatedly, for up till 6 weeks. Also, pains. What another question which patients usually ask me is that, doctor, I have delivered. Before delivery, I was having pain in the uterus. During delivery, I was having contractions. And once I have delivered, again, I am kind of feeling contractions. So, what is it? What exactly is this? See, these contractions are something which are making the uterus contract, and the uterus is coming back to its normal shape. The uterus usually is up till the belly button after you have delivered. So, you feel that you are kind of, 5 months pregnant, even after you have delivered. And I've seen patients telling me that, doctor, this tummy is still so bloated. So are you sure that everything is going on fine? So I just reassure them and tell them that this uterus is going to come back to its normal location after 2 weeks. So this is called involution of the uterus in our medical terminology, and this occurs slowly. And this involution of the uterus is what is responsible for what are called the after pains. So usually these after pains can last for up till 2 weeks, and after that these pains suddenly stop. Another important question which patients ask me is, what is the posture in which they are going to sit? See, breastfeeding itself is a very tedious process, and usually this breastfeeding you have to kind of keep on breastfeeding your baby day in and day out. So the stitches which are given on the vagina usually tend to kind of they the stitches tend to hurt a lot. So important is to not to put any stretch on the stitches. Not putting any stretch on the stitches means that you're not supposed to, you're not supposed to, you're supposed to sit in a posture in which there is maximum minimum tension on the stitches. So you are not supposed to sit cross-legged, and because sitting cross-legged would mean a lot of tension on the stitch line, because of which the stitches are going to hurt and might even start opening up. So sitting posture should be straight. Whenever you are feeding your baby, make sure that you're sitting in a comfortable position. Preferably sit and feed your baby on a chair with a pillow underneath, so that this is a posture in which the stitch line care is going to be, the stitch line is going to hurt the minimum for you. And so in case you, and also you can keep a pillow underneath, you can sit on a soft pillow, and you can kind of continue whenever you are going to sit for long intervals. See, breastfeeding in the baby usually takes place every 2 to 3 hours. So this kind of breastfeeding is going to be very tedious, and for a new mother who is having stitches in the vagina, which is an episodic scar, it can sometimes turn out to be very painful and a very exhausting and a tiring process. So make yourself very comfortable when you are sitting and feeding your baby. Make sure that you are sitting on a soft towel once you are feeding your baby, soft, sorry, pillow once you are feeding your baby, and you're supposed to stitch in a posture in which there is minimum tension on the stitch line so that the stitches don't open up. Now, what are the warning symptoms which you have to watch out for once you have had a delivery, vaginal delivery? The warning symptoms which you're going to watch out for, if you feel that, like I have said, this there is some kind of a swelling in your stitches, you feel that your stitches are paining more than what they were the day earlier, if you feel that the bleeding has suddenly turned much more than what is was 2 3 days back, or if you feel that the discharge which you are getting from your vagina is very foul smelling, that means that your stitches, there is some kind of infection. If you feel that you are having low grade fever, the fever is present, you know, you are feeling tired all day long, and you are kind of having, you feel feverish, don't feel comfortable. Another thing, if you feel that you are passing urine more and more frequently, that means these are symptoms of urinary tract infection. So, my advice to all mothers who have delivered is to drink lots and lots of fluids. This is to flush out all the toxins which are present, all the bacteria which are present in your bladder. Because once you are going in for a delivery, the bladder itself somehow goes into a sort of a, I would say, in a relaxed mode, especially after an epidural. So it's important to keep the bladder and keep emptying your bladder after every few hours. And for this, you have to continue drinking lots and lots of fluids. Also, drinking lots of fluids is going to increase your breastfeed, mind you. So again, it is very important for new mothers to drink lots of fluids. Now, another question which most patients ask me is, Doctor, what kind of water can we have after delivery? See, you can drink whichever kind of water. I mean to say, whether can we drink hot water, can we drink cold water? I just tell all my patients that please drink lots of water which is at room temperature. That is the best way out for all new mothers, but just make sure that you are taking lots and lots of fluids at regular intervals. Now, this is something which I've explained about the how you're going to care for your stitches after a vaginal delivery. What other questions which patients have after a vaginal delivery? Other questions are mostly related to breastfeeding. I tell all my patients that it's important to continue with breastfeeding on demand. Every 2 to 3 hours, you should be breastfeeding your baby. And for this, again, you need to be very relaxed, very stress free, and you need to sleep at regular intervals. And also, a well balanced, well nourished diet is something which is again very important for a new mother. So, in case you feel that your breasts have suddenly become very tight, very hard, please evacuate them immediately, because this can be something ominous and later on may even turn into something as sinister as a breast abscess, which may even have to be drained by surgery. So, in case you feel that your breasts are hard and you are suddenly feel that the expression of the milk is becoming difficult, I please pump out the milk from the breast. Don't worry, this is going to fill back again. Discard the milk and continue with breastfeeding on demand so that the breast don't become heavy and tender again. Because, like I said, it can lead to engorged breast, which can turn into a breast abscess later on. So, if case you feel feverish after your delivery, in case you feel that you have any pain in your calves, again, these are warning symptoms for which you should be telling your doctor about. Usually, I would be calling all my patients after a week of delivery to examine their stitches and to find out any symptoms of infection anywhere, because this infection can again be a source of a major problem both for the baby and for the mother. And also to explain about care of after further care after delivery. Diet is something which has to be very well balanced, well nourished, good in proteins, and of course sleep is another thing which every patient has to kind of really take in good measure. And you should be sleeping at regular intervals, because you have to get up every 2 to 3 hours to feed the baby. So try and take adequate rest and eat a proper, healthy, well balanced diet. This brings me to the end of my session today. Today, the session I have already explained about a vaginal delivery, what is the care which is to be taken after the delivery, and yes, about exercises. Another very important question which most patients ask me is about exercises. After a vaginal delivery, you can resume your normal exercises, physical activity after 4 weeks. There is no doubt about it. And after a cesarean section, obviously longer. So, care after a cesarean section is a topic which I would be taking next Thursday in the same session at 6:30 p.m. In my routine sessions on Doctor's Diary. Today, I have explained all about the care which is to be taken after a vaginal delivery. So please go ahead and ask me as many questions as you want. I would be more than happy to answer it. Yeah. So the first question comes from Latika. Okay, so how long should you rest after giving birth? See, Latika, a childbirth is a normal physiological process. There is no really need to take rest. I would say rest is something which I advocate to all my patients, because I feel that the mother needs to recover, recoup after going through the strenuous process of labor and childbirth. So, resting after delivery, you don't need bed rest, but of course, you need to sleep well, you need to take a well balanced, healthy diet, and you need to, because you are caring for yourself and for your baby. Earlier, it was only for yourself, now it's for your baby also. So, you should be resting more often, and you should not be kind of doing any household chores and uh, sitting on your laptop and doing things which you were doing earlier, watching television for long hours which you were doing earlier. I tell all mothers who have delivered with me that please try and sleep and be as rested and stress free as long as it is possible, because looking after a baby itself is a very exhausting process. So there is nothing called bed rest, but yes, you have to rest and sleep well. Now the next question comes is how can my it comes from Shubham. Shubham says, how can my wife reduce her tummy after delivery? See, Shubham, this is a question which most of my patients ask me, that how can I reduce the tummy size after delivery? See, the entire tone of the musculature is gone, and like I said, the uterus is usually after the belly button after you have delivered. It comes back to its normal position 2 weeks after the delivery. So till 2 weeks you will feel that you will somebody who is seeing you will feel that you are still pregnant, though you are not. But reducing the tummy size is something which comes only with good exercise, which you can start 4 weeks after a normal delivery. And by taking a healthy diet, not eating too much of fats, taking good amount of protein, and of course sleeping well. All this takes a long way in kind of and resuming your postnatal exercises. Like we give postnatal exercise, we explain postnatal exercises to all patients who deliver with us. So doing your postnatal exercises will go a long way in reducing your tummy after your delivery. The next question comes from Ranjana. Can she gym after 3 months of delivery? Yes, absolutely, Ranjana. Whether you have delivered vaginally or after a cesarean section, you can go to the gym after 3 months of delivery. There is no issue and no problem in that. And you can do all weights, you can do cardio, you can do everything. Okay. So thank you, dear friends. I don't think I have any more questions here. I can't see any more questions here in front of me. In case any of you have any doubts or any queries, please feel free to come over and ask me. Or you can even kind of, ask me on my homepage. I would be more than happy to welcome any doubts and solve all your queries. I would be back next Thursday with another session of Doctor's Diary, and we will take this session further. Thank you so much for joining me, and have a good day.